Hey guys, I'm going to cover today groin pain and just a couple ways you can do some tests just to see what is creating it. Obviously, it's best to go to a doc and see what it is. You can certainly come see us. We're in Huntington Beach. So groin pain, or right here, a lot of times people will think, is it my hip flexor? Is it my psoas? Is it my iliacus? Is it my so on, right? And so one of the simplest things we can do is just take the hand and pull the knee to the chest. Okay? If this bothers it, it's not the hip flexor because the hands are doing what the hip flexor's job is. So also too, if you drag this across midline here a little bit, almost like you're trying to touch your knees together, or even sitting in this position, if this aggravates it, it's probably not hip flexor, it's probably hip impingement. So I'm going to grab this model and just show you kind of like what hip impingement is. And by the way, if you have this, it's pretty simple to reduce. The sad thing is, it's going to sound really snobby, but there's not a lot of clinics that do it very well. Okay, so it's usually can be reduced within a couple weeks if you catch them very early. Okay, so notice this area right here. There's this rim. Okay, this is the pelvis right here, and so I'm going to have it right here, kind of as if I had a tight hip flexor or like an arched back. Notice this thing tends to drop down, and if we just kind of get the belly wall and the glutes to work, it kind of raises it up a little bit. And so this rim changes its orientation, and we know this by radiology studies. And so what this does is this allows more room for the hip to actually move without impinging on this. The labrum is also in here too. So what helps in this process is really challenging the glutes, and I do mean challenging the glutes as well as the belly wall and building some nice internal pressure within the cylinder right here. Again, we've had people who have come in and have groin pain for 3 to 4 months at a time, and we just do 2 sessions with them, and they're able to walk out having no groin pain whatsoever, 0 out of 10 pain when they first came in with a 5 or a 6. So again, do these tests and just see, because it's confusing a lot of times. People they'll look for an MRI to see if this is hip impingement. This doesn't have to be positive on an image, and in fact, a lot of MRIs and X-rays will be negative. Okay. However, the mechanics are this, and a little bit of in, okay? This is called Fadir's test, and it's one of the classic presentations of hip impingement. Hope that's helpful. I do have a massive article on hip impingement. If you're looking to read it, it's on p2sportscare.com. There's also a guide on there as well. Come see us in Huntington Beach. These things they're easy. They're simple to reduce. They're challenging for you because you got to do the work, but they're simple. Okay, we can lay a nice plan out for you and everything. Just let us know how to help.